Hi everybody. I'm Chelsea King. I am the executive director of the Oregon Health and Education Collaborative, and I'm very happy to be here today with Kali Thorne Ladd, who is a board member on the collaborative and also is the CEO of the Children's Institute, a statewide policy organization focused on making Oregon the best place to be a kid. What motivated you to serve on the board of the collaborative?
I believed in the merging or the coming together of health and education because I understood that in order for children to learn, their health and well-being had to be in place. And I felt like, at the time I was at Kairos when I first really connected with the work, and I realized that, our kids, if they're dealing with things either around mental health or physical health, they're not in a space where they can actually receive and retain information that they're learning in school. And yet the sectors don't intersect very much. And so I just believe that we needed to think differently about how we operate and work in collaboration to support children.
What makes this such an important time to invest?
Um, the science, I think the neuroscience around learning and development tells us the brain develops most rapidly in the first year of life. 1 million neural connections are being made per minute in the first year of a child's life. And the impact of trauma and stress on the brain is profound in that early time, both in utero and in the first 1,000 days. I think when you know that the brain architecture is being set, that scaffolding of the brain that helps determine who a child will become and how they will manage their life happens in those first 1,000 days, it becomes very important to support children and families during that time. We know a lot of research and science around serve and return and all these things that happen that stimulate neural connections and brain growth. We have our best opportunity to support thriving adults by focusing on the first 1,000 days. There's a reason why most every well-resourced nation in the world provides extended time off to families and mothers in particular after they have a child. In most of these countries, they get a year or more off. Our standard is 6 weeks to 8 weeks. I mean, what are we doing? And it's not an accident. It's because they know what the science says. And to know it and ignore it makes us all culpable on what the outputs are. The state has also looked at rolling out universal home visiting, and universal home visiting has a big impact on the first 1,000 days, first year of life. And so, as we begin to roll that out, and the council in Oregon, Early Learning Council, is looking at how they support that statewide, that's a big deal for that space. And of course, Oregon, I think, is one of the only states in the nation that really supports Medicaid for all children.
I would love to hear you just dream. If everything worked, how it could work to really give every child and family what they needed to be well, what might the system look like?
It would be unrecognizable, I think, to what we have today. So I would say that I think the system would ensure families have, time off when they have a baby. I mean, I would look to countries. There was a podcast recently, Ezra Klein show did an interview with folks from Sweden, and they looked at the ecosystem they have around children there. And the prioritization of children and families is radically different than what we have here. And I've seen this. I had a chance to travel in Finland and look at schools there, and you see it there as well. I feel like we would mirror a little more some of these other communities. So this has been done before. That's the thing. We actually have a blueprint. We don't have to make it up. We actually don't even have to dream big. We just have to look at what other people are doing and figure out how do we replicate it here. But the extended time off with families, the prioritization of adult-child attachment, and just relationships between children and adults, the financial support. I mean, there are places that do provide financial incentives to low-income families. Money matters, and if you don't have it, you are going to, have to get things that maybe aren't as healthy, or you have less of it. And so, there has been research and science that has said when you give cash to new moms, they do spend it on their baby. That it's a fallacy. This idea in our culture not trusting that particularly mothers want what's best for their kids and love their kids. The idea that somehow you give them cash and they're going to waste it on something frivolous is just absurd to me. And the science and research actually hasn't proven it to be true. There are states in the US that are testing out this idea. I listened to another podcast with the Center on the Developing Child that talked about a program. I want to say it was Michigan, maybe. Yeah, that is
In Flint,
yeah,
Michigan.
yeah.
Yes.
And I just thought,
What is
oh,
the name of it?
I
Do you
can't remember. It was a
remember?
clever name
Yeah.
too, and I
Yeah.
was like, that's brilliant. But I think that should be an obvious thing. I think universal home visiting. There are all again in other nations, there is sort of a universal home visiting, no matter what your income level, because quite honestly, stress happens to all families for different reasons. It actually poverty certainly brings upon its own stress, but even middle income, well-resourced families sometimes are dealing, whether it's a death, whether it's divorce, what you name it, abuse, like that does not pick and choose based on income. So and then we have a circumstance of a national pandemic or an international pandemic that we've lived through, which created its own stress. So there are circumstances that create stress, and I think home visiting is something that should be universal. In other countries, it is that every mom has someone checking in that postpartum period to support them. That's not the partner. That's not, you know, not a government person per se. Oftentimes it's someone connected with the medical system, but supporting in that critical time. Postpartum depression is a real thing. Like how, there's just, I don't know, there's so many things. The largest things, there's the largest number of houseless humans in our country are babies. How is that possible? How are we allowing that to be possible? Um, So there's a lot that I would change. I would center children. That's the bottom line. I would center children, and our society does not do so, and to its detriment, I believe.
I do want to ask one final question, and that is just like, what else do you want to say before we end our conversation?
I think this work is important. So thanks for giving me an opportunity to talk about something I'm passionate about and care deeply about.
Be connected with the work of the Oregon Collaborative and the Upstream Initiative by following us on YouTube, on LinkedIn, and signing up for our listserv at OregonCollaborative.org.